Boost your strength, power, muscle growth, and lessen fatigue. Protect your brain and increase energy production in your cells. You supplement with it daily, but you still have doubts about its safety. Yes, we're talking about creatine and its possible negative effects on health. Creatine usage soared post the '92 Barcelona Olympics. Today, it is one of the most used supplements, with its global market surpassing a turnover of $400 million in 2022. If you've used, are using, or plan to use it, today's information will interest you. Also, at the video's end, I'll reveal the only 2 scenarios where creatine supplementation should be absolutely avoided. Pay close attention to the following reality. After taking creatine, your medical test will change considerably. This entails emotional disturbances, fear, uncertainty, but also a great overcost for health systems. However, an analytical alteration does not always indicate a functional or structural alteration. Let's examine the clinical effects of creatine intake, as this is one such case. First, analytical changes. Blood creatinine levels can rise. Creatine does not cause kidney disease, but it can mimic kidney disease. There's a major yet subtle difference. Creatine has a characteristic, and that is it metabolizes to creatinine. Your body processes it, resulting in creatinine production. So creatine turns into creatinine. The problem is, doctors and nephrologists use creatinine as an indirect marker of kidney damage. And here the important word is indirect. You'll get it instantly. Does the rise in creatinine from oral creatine consumption suggest some kidney damage? No, it only imitates but doesn't induce kidney disease. How do we know? Look, daily between 1 and 3% of the total content of creatine and phosphocreatine in your body spontaneously transforms without enzymatic participation in a constant and irreversible way into creatinine. And I remind you that you have 2/3 of all the creatine in the body stored in your muscles. So the more muscle, the more creatine, and the more creatine, the more creatinine. This is the first thing you have to understand. The more creatine, the more creatinine, because the conversion, as I just told you, is constant, stable, and irreversible. And 3% of 100 is more than 3% of 50, right? Let's proceed. Where does the discharged creatinine go? Into the blood, which is where we measure it, to then go to the kidneys, to be filtered by the renal glomeruli and end up being excreted in the urine. The kidney also filters creatinine at a constant and stable rate. And it is precisely for this reason that plasma creatinine is used as an indirect indicator of kidney damage. It's simple. If the kidneys were not working well, creatinine would rise because it would not be filtering it properly. This is why plasma creatinine and creatinine clearance are used as an indirect marker of kidney damage. But is there another cause of elevated plasma creatinine that is in the blood, even when the kidneys are perfectly fine? Sure, increase your creatine intake. We've stated that daily, 1 to 3% of creatine turns into creatinine. What will happen if we supplement with creatine? That there will be more production of creatinine because there is more creatine, and as the kidneys filter it at a steady rate, that is, they do not increase the rate of creatinine clearance because of having more, then the plasma creatinine is going to be elevated, an elevation that is usually dose dependent. The more creatine dose, the higher the creatinine elevation. But notice that we said earlier that blood creatinine can increase. I say it can, as it doesn't always rise. And formulations like ethyl ester creatine produce higher creatinine elevations than monohydrate creatine, for example. What happens if you have seen on the internet the benefits of creatine and you take a load of 0.7 ounces of creatine, and then the next day you do an annual company analysis? Well, your creatinine is going to come out much higher and you are going to get scared. What is the most common clinical case? Well, that of a young man who is, well, athletic with normal previous renal function, who gets a checkup or for another reason. To his surprise, the creatinine comes out slightly elevated in a range that usually oscillates between 1.4 and 1.8 mg per deciliter, but it can even be higher. Remember that the normal range is approximately 0.7 to 1.3 mg/deciliter in men and 0.5 to 1.1 in women. At the same time, the glomerular filtration rate or creatinine clearance comes out decreased. Why? Because these parameters directly rely on plasma creatinine values. The result, a very scared patient, a very surprised doctor, and a few weeks of uncertainty until the analysis is done again after having left the creatine. And often it is left forever after this scare. Is there any way to corroborate that the kidneys are still working perfectly despite creatine supplementation? Yes, there is, but it is not usually used. Cystatin C is a protein found in all nucleated cells that, similar to creatinine, is consistently filtered by the kidneys. But of course, during supplementation with creatinine, the levels of cystatin C in the blood remain stable. That is, the production of cystatin C is a process that is not affected by protein catabolism or creatine intake, so it is more accurate to assess potential kidney damage associated with creatine intake. Does anything else alter when I take creatine apart from creatinine? There is a very common situation that does not directly depend on creatine, but on the typical context in which creatine is usually consumed. In the context of a high-protein diet, urea nitrogen, a product of amino acid metabolism, increases. Blood urea nitrogen. Blood urea nitrogen is a common analysis term, especially for someone beginning creatine supplementation, often in conjunction with protein, typically whey protein or similar. And this would cause a sudden increase in their protein intake and therefore also this parameter, the blood urea nitrogen. However, if protein intake is normal, the boom will not rise, and this dissociation of high creatinine and normal boom should make us think that the cause is creatine and not chronic kidney failure. In chronic kidney disease, creatinine and the boom increase. And finally, as the glomerular filtration rate is estimated from creatinine, you have the formula here. It will also be altered, in this case reduced, overdiagnosing chronic kidney disease or chronic renal failure. As you can guess, this leads to very unfavorable outcomes. We're referring not just to emotional impacts, but also heightened care responsibilities and health system expenses. Why? More consultations, more referrals, more analytics, more additional tests. Ignorance is harmful. So, as a conclusion, does long-term creatine supplementation cause kidney damage in healthy people? No, but it can briefly increase plasma creatinine. Yes, especially when it is measured with enzymatic means and not with chromatographic techniques like high-performance liquid chromatography. However, it is most common that your creatinine levels do not even rise, they remain within the normal range, even with supplementation. In this review by Presky and Rawson, of 22 studies, only in 2 of the 22 was an increase in serum creatinine above the normal range demonstrated. And can you reduce the glomerular filtration rate or creatinine clearance? Well, yes, slightly, since both parameters are calculated directly using plasma creatinine values. Can it alter other indicative parameters of chronic kidney disease, such as urea or albuminuria? No, it doesn't change them. Any unmentioned side effects? Essentially one, and quite worrying. You will gain some weight when supplementing with creatine. Supplementing with creatine results in weight gain. Depending on the person, you can gain between 1 and 6.61 pounds in the first week. But don't worry, because gaining weight does not mean gaining fat. Creatine increases intracellular water. It swells the muscle cell by attracting water into it, but it does not increase your body fat percentage in any way. You retain a bit of water, and this is an effect that occurs in the first few weeks and then tends to normalize, as if your body quickly adapts to the new amounts of intramuscular creatine. This side effect has functional repercussions in sports where weight is important. For most high-level runners, cyclists, climbers, and many others, the potential benefits of taking creatine will be overshadowed by a weight gain that decreases their performance. Why? Because of the nature of the sport. Besides what's already discussed, creatine supplementation can sometimes cause issues. There are mainly two situations in which scientific evidence does agree that creatine should not be used. First, people with a diagnosed chronic kidney disease. This is mainly because long-term administration of creatine in people with kidney dysfunction will falsify the analytical results, interfering with the doctor's ability to determine the progression and status of the kidney disease and therefore to make important therapeutic decisions. Although there are other indicators of kidney dysfunction that are not altered by the intake of creatinine, we have said it, cystatin C, urea, albuminuria, it is true that serum creatinine and creatinine clearance are two markers widely used around the world to assess kidney function. And to the question, but Borja, does creatine accelerate or not accelerate kidney damage in people who already have chronic kidney failure? The response is, due to insufficient evidence, its consumption is not advised if you have kidney damage, especially considering the problem I previously mentioned. In second situation, people who are taking nephrotoxic medication. The second case in which you should not ingest creatine supplements is the use of nephrotoxic drugs. Examples include aminoglycosides, antibiotics, long-term use of NSAIDs, lithium, certain loop diuretics, some chemotherapies, among others. There are reports that the combined use of these medications and creatine could further accentuate kidney damage. In conclusion, the few published case studies linking creatine consumption and kidney disease do not take into account the concurrent use of medication, other nephrotoxic supplements, or the use of anabolic steroids, especially the latter. In these cases, harm is attributed to creatine when it is caused by other elements. In the multiple controlled intervention studies where the effect of creatine supplementation on kidney function has been evaluated, the conclusions are clear and unanimous. Creatine supplementation at the recommended dose does not cause kidney damage in healthy individuals. If you are a professional and want to delve deeper into this topic, I recommend this 2021 review. Thanks for your attention and time. Keep empowering. Big hug.